Welcome back to Cablevision's Hudson News Edition. I'm Sherry Carabin. We continue our two-part series on going back to school. Today we'll be discussing attention deficit hyperactivity disorder, or ADHD, which if undiagnosed can impact your child's ability to learn. Joining me now to talk more about it is Dr. Gabriel Kaplan, Executive Director of Behavioral Health at Hoboken University Medical Center. Welcome back.
Thank you for having me, Sherry.
Let's start off by defining ADHD.
Well, attention deficit hyperactivity disorder is a disorder that's very common, and it affects anywhere between 4 to 10% of children. And it essentially consists of difficulty paying attention, difficulty sitting still, and being impulsive. These are the three cardinal symptoms of attention deficit disorder. And this is an important disorder because, as I said, it affects many, many children. And when it's mild, probably can be overcome with very simple measures. But when it's severe, it requires significant treatment, and the complications of ADHD can be very difficult for the child and for the family.
Is there a particular age where this is more likely to happen?
Well, children actually develop this over time, and there's a genetic vulnerability to this disorder. However, we see it mostly when children come to school, and the reason for that is, as I said, difficulty sitting still, difficulty paying attention, and being impulsive are things that maybe at home are not being noticed. But when the child starts school, either kindergarten or first grade, the teachers really catch on to the problem fairly quickly, and they tell the parents. It's pretty common for parents to come to my office and said, my child was perfectly okay until he started school. There must be something going on at school. And in reality, what tends to happen is that the problems did not manifest themselves at home. You require the structure of the class in order to see this happening.
Now, in terms of treatment, what type of treatment options are available?
There are multiple kinds of treatments for this. In the mildest cases, just having some behavior modification can be very helpful. So to help the child organize, have trouble organizing is one of the other problems with ADHD, you can institute rewards. They can be very simple, from a treat to renting a video or internet time, placing the child at the front of the class where they can be very close to the teacher, and that sort of one-to-one attention can be helpful. However, when these things do not work, there are very, very efficient medications that can be used to help the child concentrate, pay attention, and do well in school. Now, of course, if it was just simply a matter of just getting good grades, essentially there would be no reason to medicate anybody. But the problem with ADHD is that impulsivity leads to peer problems, it leads to antisocial problems, and there's also significant evidence suggesting that children who are untreated can have problems with drugs and can have problems with conduct difficulties. So when the problem is there, you really want to treat it, and the medications are very safe, and more than that, are very effective.
Does therapy help as well?
Therapy can be helpful, as I said, in the milder cases, and it's always important to combine the therapy with the medication. So even when one prescribes medication, the therapy has to be there to help the child adapt to the school, to the peers, and to improve on a one-to-one relationship.
And is the therapy always behavior modification, or can it be one-on-one counseling?
The most effective therapy, the research suggests, is therapy of a behavioral or cognitive nature. So this is a therapy where the child and the therapist and the family try and find practical solutions for the problems of a day-to-day situation.
Should the teacher be involved?
The teachers are involved. They're a very significant part of the treatment, and especially of the progress. Because the best way of knowing whether this child is getting better or not is by the feedback of the teacher.
Okay, well, thank you very much for joining me to talk about this important subject.
You're very welcome.
And if you would like more information on ADHD, you can call 201-792-8200. And don't go away, because we'll be right back.